of speech works both ways. We respect the rights of those who choose to protest, as these rights are precisely what our members have fought, and in many cases died for. He also continued, but imposing corporate censorship to deny the same right to those veterans who have secured it for us all is reprehensible and totally beyond the pale. NFL spokesman Brian McCarthy told the Army Times that the advertisement program is designed for fans to commemorate and celebrate the game, players, teams, and the Super Bowl. He also added, it's never been a place for advertising that could be considered by some as a political statement. The AMVETS chief noted the irony that the NFL continues to claim that the anti-American protests by millionaire players on the field represent free speech, even as the league denies free speech to AMVETS. AMVETS officials said, though, that the same Please Stand ad was accepted by the National Hockey League and Major League Baseball for inclusion in their All-Star Games programs. The organization sees the advertisement as an extension of their role as a nonpartisan advocate for veterans and their families. He also states that you can call the NFL at area code 212-450-2000 and tell Commissioner Goodell to run the AMVETS ad. That number at the NFL is 212-450-2000. He's right. It's a two-way street. What's good for one is good for the other. The Department of Veterans Affairs is revolutionizing the use of new healthcare technology to deliver convenient, accessible healthcare to veterans. The VA's telehealth service is a mission critical to the future direction of the VA and utilizes health informatics, disease management, and telehealth technologies to care for and provide case management. More importantly, it helps the veterans to continue to live independently in their own home, local communities, and stay out of the hospital. Technology is the tool the veteran utilizes through telehealth service to interact with their care coordinators. But the real key component to the success of the program is case management and personal connection. The veteran establishes a relationship with a go-to person that is essential for the veteran's overall health care plan and personal health goals. And according to the VA Health, it's that time of the year when colds and influenza spreads across the country, bringing discomfort to many, and the flu is peaking earlier this year than usual, with widespread cases reported in every state across the continental United States, according to the Center for Disease Control and Prevention. On other news from the Department of Veterans Affairs, at a time when the Department of Veterans Affairs has its hands full combating the opiate epidemic among veterans, walking a tightrope on medical cannabis research, clipping away at its claims backlog, and ending veteran suicide, it's struggling to find time and resources to end veterans' homelessness. The department is also, for the National Cemetery Administration, is seeking nominations of qualified candidates to be considered for appointment as a member of the Advisory Committee on cemeteries and memorials. Nominations of qualified candidates are being sought to fill upcoming vacancies, and the committee must be received no later than 5 p.m. Eastern Standard Time on January 31st, 2018, which would be next Wednesday. Gina Ortez Jones wants to build a better Texas. The Iraq War veteran and out lesbian is campaigning for U.S. Congress in the Lone Star State's 23rd Congressional District. Philippine officials and executives involved in caring for the country's war veterans urged Thursday the younger generation of Filipinos to keep remembering the 1942 Death March and those in Japan to learn about it. The National Mall in D.C. is studded with monuments to iconic people and events, from presidents to wars to civil rights leader Martin Luther King Jr. Later this month, finalists will be announced for a memorial to a group with less name recognition, Native American veterans. That's been a long time coming. The VA's National PTSD Brain Bank collaborates with Pink Concussions Group. Women's veterans urged to donate brains for research. Today, the U.S. Department of Veterans Affairs announced a collaboration between the National Center for PTSD and the non-profit organization Pink Concussions, encouraging women to donate their brains for the purpose of research of the effects of traumatic brain injury and post-traumatic stress disorder. In the past, the focus of TBI and PTSD brain research has primarily been based on male brains, without any active recruitment for women. We have a lot to learn about the female brain deals with TBI and post-traumatic stress. So they're going to be looking for candidates to make that donation. Also, the Department of Veterans Affairs and the Department of Health and Human Services, Centers for Medicare and Medicaid Services, announced a partnership to share data analytic tools, and best practices for identifying and preventing fraud, waste, and abuse. The newest partnership enhances ongoing efforts between the country's two largest public-private healthcare payment organizations to help America's veterans by leveraging the gains made by the CMS. The VA-HHS Alliance represents the latest example of VA's commitment to find partners to assist with identifying new and innovative ways to seek out fraud, waste, and abuse, and ensure every tax dollar given to VA supports veterans. The VA Secretary said this effort marks another step toward achieving President Trump's 10-point plan to reform the VA by collaborating with our federal partners to improve VA's ability to investigate fraud and wrongdoings in the VA. CMS continues to focus on reducing and eliminating fraud, waste, and abuse in Medicare, and in 2010 it established the Center for Program Integrity to help with this work. CMS estimates that its program integrity activities saved Medicare operations $17 billion in fiscal 2015. And more veterans news. 8 transgender volunteers have signed paperwork to join the active duty ranks of the Air Force, the Pentagon acknowledged Tuesday. The 8 are among the first known transgender applicants to the military since the Pentagon opened recruiting to them on January 1st. An all-female UK team of soldiers crossed the Antarctic. A team of British soldiers have become the first all-female group to cross Antarctica using only muscle power. After spending 62 days on the ice, they sledded 1,056 miles, pulling sleds weighing 176 pounds and dealing with temperatures as low as -40. After spending the 62 days on the ice, the British Army's Ice Maiden expedition crossed the finish line at Hercules Inlet this past Saturday. State legislators and VA staff should support plan to aid female veterans in the region. A proposal to the House homeless and down on their luck female veterans in new transitional housing at the Oak Hill Renaissance Place County Office Building in Youngstown rises as a win-win proposition. It is a win first and foremost for the growing numbers of veterans in the region and state who find themselves displaced by poverty, divorce, or other misfortunes. And Gina Ortiz-Jones wants to build a better Texas. The Iraq War veteran and outspoken lesbian is campaigning for the U.S. Congress in the Lone Star State's 23rd Congressional District. A lesbian veteran, 90 years old, expelled from the Air Force in 1955, finally gets her honorable discharge. Helen Grace James said upon receiving the long-awaited news, "I'm still trying to process it." And the Missileers Air Force has trained 247 women for a nuclear launch. Buried more than 60 feet below the North Dakota plains, 2 women sit in front of a panel of blinking lights, switches, and classified code books. For 24 hours straight, they will fill the time as they do most workdays by studying for advanced degrees, drinking tea, reviewing protocol, and trading gossip and sleep shifts. I know what those were like, because when I was in the Air Force in Missouri and Wyoming, there were occasions where we had to go over to those silos for an inspection. So it's not that big of an area, and you're there for the whole 24-hour period. And the Wounded Warrior Amputee team will be versing the Public Employees softball team this coming Saturday, January 27th. It's a free event. The game time is 5 p.m. at the Joker Marchant Stadium. Also, 2 pieces of information. According to the health system, military health system, January is Cervical Cancer Awareness Month. Cervical cancer used to be one of the most common causes of cancer deaths for women in the United States. Thankfully, this rate has decreased over the past 30 years. It's estimated that more than 12,000 new cases of invasive cervical cancer will be diagnosed this year, and about 4,200 women will die from cervical cancer. And on a final note,